NHI, Dr. Cedric Sihlangu, joins us for some reaction. Very good evening to you, Dr. Sihlangu. Thank you for your time. I mean, we listened to the president saying that government will go ahead. They're forging ahead with the NHI scheme, and he more or less stuck to the main themes that government has been repeating over the years, like reducing inequality, saving lives through fair treatment and so forth. Was this an expected position on your end?
Evening, Paul, and thank you for the invite. I think for us it comes as a relief for the simple reason that in the past 2 or 3 days there's been a lot of media reports that there's been agreements in government, in the GNU, to water down the NHI, that certain sections of the NHI were not going to be implemented. For example, Section 33, that speaks to the medical schemes. However, what the president did, which is very, we are happy about, is that he came very strongly to indicate that indeed his government is forging right along with the implementation of the NHI. In fact, this time around, he even went as far as breaking down the processes that are going to be put in place. For example, the Ministerial Advisory Council. He speaks of what we've been talking of in terms of the digital information systems that speaks to your digital record keeping, because most of the records, of course, we know they get lost time and again, with patients being lost in follow-up. So what we can see is that there's clear commitment with the implementation of the NHI, and I think that has brought about quite substantial relief for us, because we're quite worried that it seems as if, at least from the media reports of late, that there's some intention to water it down, and that's not the case. We are quite confident that, in fact, when you look at the infrastructure that will be rolled out in terms of the building of central hospitals, but what is key that we must point out is the president speaks of improved waiting times, but you can't have improved waiting times without pronouncing quite categorically on staffing of these institutions, because you're going to have beautiful white elephants if you don't come very strongly of a staffing of health facilities. And I think that is one aspect that would have wished the president would have touched a bit more. He spoke broadly on issues of employment, and we're not taking away from that, but would have hoped that on this one he would have dwelled a bit more to actually expatiate there.
Absolutely. And the other thing that he didn't make any mention of are the changes to the laws. I mean, you touched a little bit on the no mention of the medical aids, which of course leaves a few gaps and a few questions as he speaks about it on this platform this evening.
Yeah, look, what we know, as a matter of fact, is that we've got a National Health Insurance Act. That act remains an act of parliament and is enforceable. It's a law in this country. There's no two parties that can go to a corner somewhere and change an act of parliament. So for us, it was bizarre that there was this notion that Section 33 will be adjusted to accommodate this notion of the medical schemes continuing to provide parallel services to what the NHI will be providing. So we know, as a matter of fact, unfortunately, I've had the opportunity to even speak with the minister on this, and there's no such a thing, as a matter of fact. And the act remains intact as it is, and this government will be implementing the act as it stands. So it deals away with that notion of a watered-down NHI. There's no such a thing. In fact, it would be impossible for an act to be passed through parliament and then you have two parties in a corner say that they are changing an act of parliament. Yeah,
it's important that you also make mention of how the finer details on the healthcare, employees in terms of doctors, medical doctors sitting at home, graduates, I mean, close to 1,800 of them are sitting at home and not able to get work because of the budget constraints. That in itself raises a lot of questions. And, how would you have liked to see the president approach that matter with all these questions around what will happen to these medical graduates?
Yeah, I think the president, of course, being a president, he had to be all-encompassing, and he spoke broadly on job creation and creating employment opportunities. I didn't go to the bone on this one, but I think that could be excused What we therefore expect, it's in the budget from the Minister of Finance,
yes,
to go deeper into allocating actual funds for that purpose, where we would expect that to enable these facilities that are being built. I mean, you mentioned quite a number of them that are being built. The question is, who's going to work in those facilities? Therefore, Treasury needs to come and tell us that over and above infrastructure allocation for the building purposes, we've gone on to allocate this much to appoint all the unemployed healthcare workers, encompassing of nurses, doctors, and you name them. That's what we're expecting from the finance minister.
Yeah. The concern, of course, was another big area that we've been covering quite broadly on SABC News, is the US's decision to suspend funding for HIV/AIDS and TB programs in Africa. Although we've heard that, South Africa gets about 17% in terms of the ratio breakdown, it is small, but still very significant.
Yeah, I think we've said in numerous platforms that I think it's a very quick and good wake-up call for not only South Africa but for African countries to begin to be self-sufficient and self-reliant. You don't want, as a sovereign state, to have powers from elsewhere potentially beginning to meddle in your affairs on the basis that they give you funding. So yes, 70% might be seen as rather not so significant in the bigger scheme of things, but it is substantial when you're considering that there are a lot of healthcare workers who are employed under the PEPFAR, funding and so forth, that are looking at facing potential unemployment. And of course, not only that, the impact that will have on the communities that we're relying in terms of this aid. Now, of course, the president was correct in saying, as a government, we need to now look at internal solutions to actually find how we're going to deal with this situation. Notwithstanding that, we do appreciate any help if it comes from outside, but it's high time that as a government, we actually are self-sustaining and we put a budget that will be able to continue to provide, for example, your ARVs and your continuous treatment insofar as TBs are concerned.
Very well. Thank you so much for speaking to us this evening, weighing in on some reaction there by President Cyril Ramaphosa's State of the Nation address, speaking there to the Dr. Cedric Sihlangu, of course, giving some perspective around some of the highlights around the NHI bill as was articulated by the President.